Hello, everybody. It is 12 noon here, and today we're going to have a really cool conversation with Dr. Chris Gayton, who is a hand surgeon, and just waiting to bring him on. And it's going to be a lot of fun because, as an OBGYN, we don't really talk about like hand health and bone health as it relates to hands. We talk a lot about the spine, about the hip, but not so much about the hands. So I'm really excited to speak to Dr. Gayton. He is coming on right now. Let's see. For those who are watching, I'm Dr. Prabhakar, TheFibroidDoc, and you are joining me for an Instagram Live today titled Healing Hands, and we are going to be talking to Dr. Chris Gayton, and there he is. Hi, Chris.
I'm great.
How are you? Great. Thank you for joining. I was just telling our listeners, our viewers that we don't really talk a lot about hands and hand health in gynecology, so I'm really excited for this chat. So I would love it if you could introduce yourself to our viewers and tell us a little bit about what you do.
I'm having some difficulty seeing right at the moment, but hopefully with the pop-ups.
I can see you well. There we go. I can see you and hear you fine.
So I'll just talk through it. So I'm doing great. So I'm an orthopedic hand surgeon, and I'm excited to be here today.
Awesome. And you
Correct.
are in South Carolina,
yes, I'm
is that
in
right?
the Myrtle Beach area.
Right. Okay.
And
okay. All right. And so for those who don't know, orthopedic surgery is a specialty, right after medical school, and
correct.
I believe it's a 5-year residency. Is that right? Okay. Okay. And then what made you, specialize in
So
hand
I
surgery?
always liked orthopedics in med school. And then during medical school, or even before medical school, I thought I wanted to go into orthopedics. And then in medical school, I was able to work with a hand surgeon. And so that allowed me to be able to see the anatomy and all the different conditions. And I like the variety of hand surgery. And so that kind of kept pushing me towards orthopedics. And then during residency, I was deciding what I wanted to do, and still kind of kept coming back to hand surgery. So it's an extra year of training after orthopedics. You do a fellowship in hand surgery.
Awesome. All right. I remember when I was a medical student, in the anatomy lab, when we had to dissect the hand, that was one of the coolest things. I mean, like just looking at how all the tendons like move all the fingers. I mean, I still just vividly remember that and remember thinking like, this is so cool. Of course, I chose something completely different, but so what are some cool things about the hands that maybe people don't know, like that you could share with us? Of course, we use our hands for everything. We're always, using both our hands, our fingers, for a variety of activities throughout the day. But maybe could you share with us something cool, like, I don't know, the number of tendons or kind of the bones or something that people don't really know about the hand?
There are 8 small bones in your wrist, and so it's very common to break your wrist. Usually that's your radius, and so that can happen with osteoporosis, those sort of things. But yes, I think I've forgotten a lot of those facts as far as the different tendons
okay. I didn't give you any
so
warning
forth.
on that one.
But yes, there are 3 bones in each of your fingers, 2 bones in your thumb, and so that's 14 bones just in your fingers. And so there's lots of intricate anatomy with the hand and the wrist. And so all those things, if they're not working perfectly together, it can cause problems.
Yeah, That's a good segue, actually. So, what are like maybe what are two or three things that you see in people sort of middle age, 40s and above, in terms of things that can go wrong with your hand, other than, hand, wrist, other than obviously, you cut it or something. But what are some other things to watch out for in
Sure,
this age group? Either just generally or
sure.
perhaps even things that affect women a
Yeah.
little bit more.
Yeah,
I would love
so
to
I mean,
hear.
this age group is kind of the most common patients that I see, even though sometimes a little bit older, 60s and 70s as well. But in younger women, probably in the 40s range, is carpal tunnel is the most common thing that I see, and that starts to become very common. And I think there's a little higher prevalence in women, but overall, in the general population, 1 in 10 people will get carpal tunnel syndrome at some point in their lifespan. And then, so people who are obese are even more likely to get carpal tunnel syndrome. So they're 2.5 times more likely. So maybe up to even 25% of women who are overweight are at risk for carpal tunnel syndrome. And then I like to talk about the five most common things that I see. And so those
Sure.
are one, carpal tunnel syndrome, so numbness and tingling in your fingers. Number two would be trigger finger or tendonitis in your hand and your finger, as the finger can catch or pop. And then number three would be thumb arthritis, so pain at the base of your thumb when you're opening bottles or jars, those sort of things. Number four would be wrist tendonitis. We call that de Quervain's tendonitis. And it's also known as mommy's wrist. So lots of new moms get this from lifting their babies, or grandmoms can get this when they're babysitting, watching kids a lot. And then also new pet owners sometimes, or just everyday overuse sort of tendonitis. And then the other thing that I see a lot, especially in women, is arthritis in the hand. So you start getting bumps on your fingers, like we said, the thumb arthritis. And so joints start getting bigger. It's hard to get your rings on or slide or get them off over the nodules. And so those are
Hmm.
probably the five most common things that I see in the office.
All right. So, that was really, I mean, I just learned a lot right there. So thank you for sharing that. Um, Now, I can imagine that some of this can be attributed to some genetic predisposition. If your parents had probably the arthritis of the fingers, maybe you're more prone to it. Some of it, as you mentioned, probably is just lifestyle oriented, like how we hold things. I know when I was a new mom, I had like really bad back pain depending on how I was sitting and stuff like that. So there are things that probably are attributed to that. And you had mentioned that carpal tunnel is one of the most common ones that you see, of the wrist and the hand. Um, would you be able to share with us some things that we should keep in mind that you share with your patients, like on how to maybe prevent some of this, either a carpal tunnel or um, kind of ways in which we should be thinking about working with our hands. I know a lot of, when we talk about back pain and stuff, physical therapists talk about ergonomics, how we should be sitting up and how we should be walking. But what about the hands? Like, I haven't really
Yeah, so
heard anything about that.
ergonomics can definitely be important if you're working at a computer all day or have a desk type job. And so lots of patients with carpal tunnel syndrome will get better if they wear a brace. And so you start off with sleeping in the brace at night, but things that you can do to prevent that are to try to set up your desk where your wrist is more flat. And so when you're typing, that your wrist is flat like that. And so if you kink off the wrist one way or the other, a lot of times when we're sleeping, we curl our wrist up like this, and that can cause increased pressure on the nerve and can exacerbate or worsen carpal tunnel syndrome. And then so some of the vibrating tools, those things can put you at more risk for carpal tunnel syndrome. So trying to take breaks during the day if you're working at a computer all day, getting up. I like to say that our bodies are made to move, and so working on doing some finger
Hmm.
exercises, get up and walk and take a break every 30 minutes or so throughout the day if you're doing long stretches at the computer.
Okay, great tips. Now, I take care of a lot of women who are also, in the menopausal or postmenopausal age group. And I know that's not particularly your specialty, but as a doctor who takes care of bone, what are some other tips that you would give women in that age group? I think today a lot of young people are probably exercising a lot more than previous generations. I think going to the gym and working out and having a routine is a lot more emphasized now compared to maybe our parents or grandparents' generation. But for women who are already in their 50s, 60s, 70s, 80s who didn't necessarily do that growing up, what can they do now to really help
Sure.
with general
Yeah, I
bone
think it's
health?
never too late to start moving and to start trying to get into exercises. So if you don't use your bones or strengthen your bones, then they will continue to decline and decline at a faster rate. And so I was looking at some statistics earlier today, and up to 40% of females over 50 will have a hip fracture at some point in their lifespan. So
Mm.
that's a kind of shocking statistic. And so I see a lot of women before that, if they've had a fall and they end up with a broken wrist or broken elbow, broken shoulder, those sort of things. And so we try to get them into bone to have a bone density test to start to look at their bone strength and to screen them for
Mhm.
osteoporosis. So, kind of by definition, if you have a fragility fracture or like a fall from standing and you break your wrist, you have osteoporosis. And so trying to
Right.
strengthen your bones at that point, and you know better than I do about the postmenopausal woman and like kind of the hormone considerations of that. But I like to come at it from
Yes.
the vitamins, calcium and vitamin D are important, and then also to do some sort of resistance exercise. So walking is great exercise, but it's not as great for resistance. So you need to do something with some sort of weight or like a weight machine, even like a jug of water can be enough weight where you're lifting that, or using small hand weights for curls. You can do body weight exercises. All those things are great for strengthening your bone.
Yeah, I love that you say that because I think when so many of us think about exercise, a lot of patients think about running, walking, but that's actually not enough when it comes to bone health. You do have to have the weight, either body weight with sometimes with yoga or Pilates, or using weights that you can actually strap onto your wrists or your ankles. So even if you're walking, you're carrying extra weight. People have weighted vests.
Yep.
I know some people do that. So whatever it is, it's just adding more weight to your body. And then calcium, vitamin D. That's something that I also talk to patients about. But sometimes it gets really confusing. You walk down CVS, you walk down the aisle. There's so many different types of calcium, vitamin D. Do you have any tips on like how do you just choose a simple regimen to follow? And depending on age, of course, you may need more calcium or more vitamin D, and there are some recommendations from the medical societies on that. But just, what do I choose? Is it something combined? Do I choose something separate? Like, do you have any
Yeah, I mean,
tips on that?
there's definitely different types, and you can start off with the cheapest regimen, and then talk with your doctor for specific guidance. But I was talking to our osteoporosis specialist and doing some research, and so calcium with vitamin D is always important. So you need both of them. And so the recommended daily allowance is 1,200 milligrams of calcium and then 800 to 1,000 units of vitamin D. And so I like to say 1,000 just to make sure that you're getting high enough. And so yeah,
Good
so a
enough.
lot of the supplements have 600 milligrams of calcium and then 400 to 500 units of vitamin D. And so usually you want to take that twice a day. And the if you take it twice a day, that helps with absorption because if you try it, you can only absorb so much at one time. And so if you're trying to take it all at one time, then that can upset your stomach and you're probably not getting the full benefit of it as well.
Yeah, yeah, that's a really good point. Great. So if you're just joining us, I've been talking to Dr. Chris Gayton about some bone disorders of the hand. He's an orthopedic surgeon. And if you're, please say hi if you're joining, or if you're watching this at a later point, please type in hashtag replay. Well, thank you so much for all this information. Are there any other parting words that you would, or any advice that you can think of when it comes to just taking care of our bones, but specifically of our
Yeah,
hands?
so I have a download that I have on my website at chrisgayton.com. And so it has the 5 ways that you can fix your hand pain. And so I can run through them really quickly. But the first way I talk about is with a brace. And so using a wrist brace can help with tendonitis or thumb pain, thumb arthritis, those sort of things. The second way you can fix your hand pain is with heat and cold. So warm water in the mornings can be helpful. And then ice at the end of the day can also be helpful, or after sports or activities. The next way is with exercises. So working on doing some kind of tendon gliding or nerve gliding exercises, making sure that you're keeping your fingers moving, keeping them from getting stiff. And then Tylenol and ibuprofen, so over-the-counter medicines can be helpful. And then also just working on your general overall health. And so drinking plenty of water, trying to avoid processed foods that can cause inflammation in your body. And then also exercise, diet and exercise, weight loss can be very helpful to try to prevent pain and to alleviate pain. And so those are the 5 ways that you can treat your hand pain. Again, that PDF is a free download on my website at chrisgayton.com. And then I've got lots of other videos on my social media at Chris Gayton MD, and that's on Instagram, Facebook, and YouTube. And those should be great resources for patients as well.
Yeah, thank you so much for your time and sharing your expertise. So definitely, if you are watching this at a later time, go to that website, download that PDF, share it with a friend or a family member who may be suffering from hand pain. And I've definitely watched Dr. Gayton's videos on social media. They're very helpful. They're short and sweet and to the point, and they always teach me something. So follow him on social media for more information, and you know where to find him. He's in Myrtle Beach, South Carolina. And if you need a great hand surgeon, great orthopedic surgeon. So thank you so much, Dr. Gayton, for being here and for this info. Really appreciate your time, and
Yes,
have a good rest of the
thank
day.
you. My pleasure. I think it's great that you're having doctors on and trying to educate patients as well.
Yes, absolutely. Really
All
appreciate
right.